And at the end of this, we're going to know how to identify danger signs in children. We're going to know on how to use a MUAC tape, on how to prepare an ORS solution, and finally on how to prevent diarrhea. All of this is under Integrated Community Case Management. The short name of this Integrated Community Case Management is iCCM. So iCCM is a strategy which delivers treatment intervention closer to where caregivers and sick children with access challenges are. Evidence supporting community case management has established that well-trained and supervised community health workers can effectively assess, classify, and treat or refer sick children. So, how do we identify danger signs in children? We have 8 ways we can use to identify danger signs in children. Number 1, we have diarrhea. It is diarrhea when there is 3 or more loads of watery stool in a 24-hour day. Fever. A child has a fever when a caregiver reports or feels hot to touch. Child has fever now or anytime during the last 7 days. If the caregiver doesn't know, feel the child's forehead, stomach, or underarm. If the baby feels hot, the child has fever now. Another one, we have convulsion or fits. A convulsion happens when a child has fits or spasms and the arms and legs stiffen and may have jerky movements. Difficulty in feeding or drinking. A child is not able to drink or breastfeed if the child is too weak to suck or swallow when offered a drink or breastfeed. Vomiting everything. A child who is not able to hold anything down at all has a sign of vomiting everything. Fast breathing. Children often have a cough or colds. The child with only a cough or cold is not seriously ill. Sometimes a child with cough, however, is very sick. The child might have pneumonia. Pneumonia is an infection of the lung. To assess a child with cough, he or she must be quiet and calm when you count breaths. If the child is frightened, crying, angry, or moving around, you will not be able to do an accurate count. Another one, we have chest indrawing. Pneumonia can be severe. We identify severe pneumonia by looking for chest indrawing. Chest indrawing occurs when a child breathes in and the upper chest wall goes up while the lower chest wall goes in. Severe malnutrition. Malnourished children are more likely to die than well-nourished children. If you identify children with malnutrition, you can help them get proper care. You might be able to prevent this child from dying. Use a MUAC tape. A small arm circumference read on the MUAC tape strap identifies severe malnutrition in children with severe wasting very thin, a condition called marasmus. This indicates severe malnutrition, circumference of 11.5 centimeters and below. Look at both the child's feet for swelling. This is edema. This identifies severe malnutrition in children with a condition called kwashiorkor. Although these children have severe malnutrition, their bodies are swollen, round, and palm not thin. How to use a MUAC strap or a MUAC tape. The child must be age of 6 months up to 5 years. Gently outstretch the child's arm to strengthen it. On the upper arm, find the midpoint between the shoulder and the elbow. Hold the large end of the strap against the upper arm at the midpoint. Put the other end of the strap round the child's arm and thread the grain under the strap through the second small slit in the strap coming up from below the strap. Pull both ends until the strap fits closely, but not so tight that it makes folds in the skin. Press the window at the wide end onto the strap and note the color of the marks. The color indicates the child's nutrition status. If the color is red, at the 2 marks on the strap, the child is severely malnourished. When to treat at home. Diarrhea for less than 14 days and no blood in stool. Diarrhea for less than 14 days with no danger sign needs treatment. You will be able to give the child an ORS solution and zinc tablets. Fever for less than 7 days without danger signs, we suspect malaria. Fever in all children may be a sign of malaria. Therefore, it is important to do a rapid diagnostic test for the child with fever. If the test result is positive for malaria, you will treat the child with an antimalarial. If RDTs is negative, give paracetamols and refer to a health facility for further assessment, however. High malaria risk. If RDTs are not available and cannot refer to a health facility, treat with antimalarial and follow up in 3 days. Low malaria risk. If RDTs are not available, give paracetamol and refer to a health facility for further assessment. Refer the child if the child is not improving or has a danger sign. Yellow on a MUAC strap. Cancel caregiver on feeding, or if there is a community-based feeding program, refer the child with yellow on the strap to a treatment feeding. Treat diarrhea with no blood in stool and no danger sign. How do we prepare an ORS solution? Step number 1, wash your hands with soap and water. Step number 2, use a clean container to measure half liter, which is 500 ml of safe drinking water, and this water should be warm. Step number 3, transfer the measured water from a bottle into a clean container. The container should be large enough to hold at least 1 liter of drinking water. Step number 4, cut the sachet across and pour all the content from 1 packet of ORS into a clean bowl. Step number 5, stir well using a clean spoon until the salt completely dissolves and give the child. So, refer the child if the child becomes sicker, if the child develops a fever, and if the child develops any of the danger signs. How do we store an ORS solution? Keep ORS solution in a clean covered container. Ask the caregiver to make fresh ORS solution when needed. Do not keep the mixed ORS solution for more than 12 hours. It can lose its effectiveness. And finally, you store the ORS sachet in a cool and dry place. Diarrhea prevention. How do we prevent diarrhea? We have 4 methods, 4 ways of preventing diarrhea. Number 1, we have water and sanitation hygiene. We have to maintain our sanitation, and we take good water that is treated, or we treat water before use. At this point, wash your hands with soap and water at these important times: after visiting the toilet, before preparing food, before feeding the child, and after touching other contaminated hands and surface. Dispose your child's stool into a latrine. Use clean utensils when preparing food and when feeding the child. Use clean, safe drinking water. Another one, we have nutrition and extra feeding. Feed your child only on breast milk for the first 6 months unless otherwise advised. Introduce other foods at 6 months and continue to breastfeed up to 2 years and beyond. Avoid use of feeding bottles and cup with spots. Prepare nutrition food to feed your child. Immunization. Have your child fully immunized by age 1 year. Vitamin A. Ensure your child gets vitamin A supplement every 6 months from 6 months of age to 5 years.